Hi everybody, welcome to Rehab 543, Introduction to Sexually Transmitted and Bloodborne Infections, or STBBIs. My name is Lokanc-Diluzio. This week there are two presentations. This first presentation I provide a voiceover. In the second presentation is just one for you to review or read on your own and watch some embedded videos. So what's ahead? I will first begin this presentation with discussing some terms. Next, I'll discuss a general overview of types of STBBIs, then the significance of STBBIs. I'll also discuss STBBI rates and calculations, and the rates will be provided from an Alberta and Canadian perspective. And I will conclude with discussing some databases containing statistics on STBBIs so that you can gather some information on your own if you choose to. Before I move on to provide the information in this presentation, I do want to say that I recognize that some of you might be coming into this course with a solid foundation or knowledge base of STBBIs. If that is the case, feel free to not listen to the presentation. I've posted the presentation in PDF form, so you could quickly review that if you choose to. But hopefully for those of you that don't have a lot of knowledge or background, you will find this helpful and interesting. Over the years, STIs have been labeled in different ways, including venereal disease or VD, which is a reference to Venus, the Roman goddess of love. In the 1970s, the term VD was viewed as inaccurate and replaced by sexually transmitted disease, or STD. In Canada, STI became the preferred term, as STI is viewed as an encompassing term that includes infections which may be asymptomatic. Recently, the acronym STBBI, or Sexually Transmitted and Bloodborne Infection, has been used when referring to both STIs and bloodborne infections. So throughout my presentation, I may use the term STBBI or STI or BBI as applicable. I'm not going to go into great detail regarding the various types of STBBIs because the required reading describes symptoms, transmission, diagnosis, and treatment in some detail. The most common reportable bacterial STBBIs are chlamydia, gonorrhea, and syphilis. Bacterial infections are easy to treat and cure if detected early. Vaginal infections include bacterial vaginosis, yeast, and trichomoniasis. Trichomoniasis is a parasitic infection. Viral infections include HPV, or human papillomavirus, and herpes. Viral infections can be treated but not cured. And BBIs include hepatitis B and C, and of course HIV as well, which can lead to AIDS. BBIs can be spread by the blood and other high-risk body fluids such as semen, vaginal or rectal fluid. And finally, ectoparasites include pubic lice and scabies. Ectoparasites are easy to treat and cure. Significance of STBBIs. STBBIs are a significant public health issue in Canada. They cost the healthcare system a lot of money, and people affected may encounter stigmatization and discrimination. STBBIs often elicit emotional reactions such as anxiety, stress, fear, or even shame. The stigma of STBBIs may impede people from protecting themselves as well as from seeking testing and treatment. Societal reactions of intolerance towards people at risk for contracting STBBIs, as well as those living with HIV and AIDS, may further stigmatize populations who already experience many health inequities. On these next few slides, I provide a summary of a piece of Canadian research that addresses the topic of stigma. The title of the research is called A Focus Group Qualitative Study of HIV Stigma in the Canadian Healthcare System, and the research was conducted by Wagner, McShane, and Hart in 2016. HIV-related stigma in the healthcare system has an ongoing negative effect on the physical, mental, and sexual health of those living with HIV. A power imbalance exists between patients living with HIV and their healthcare providers, which may cause further stigma and vulnerability. The study examined, from a critical perspective, the perception of healthcare providers' attitudes and beliefs regarding HIV-positive individuals. A total of 26 people took part in 4 focus groups. The groups were comprised of 6 males and 5 women living with, and 5 females living with HIV, nursing and medical students, there were 9 of them, and a multidisciplinary HIV healthcare providers, and there were 6 people in that group. Focus groups were 60 to 75 minutes in length. They were audio taped and then transcribed. The researchers asked 4 open-ended questions exploring stigma and perceived attitudes, beliefs, and actions in relation to people living with HIV. To analyze the data, the researchers used immersion crystallization to promote theme development, which was data-driven versus imposing pre-existing notions of themes on the data. And the analysis revealed 2 main thematic categories and several related theses. Thematic category number 1, HIV-specific behaviors. This thematic category consisted of 3 themes. HIV is a complex and changing chronic illness that differs from individual to individual. Some service providers or healthcare providers had positive characteristics that included non-judgmental, thoughtful, honest, comfortable, compassionate, and advocacy. And there's a cumulative impact on patient satisfaction. Early negative and stigmatizing experiences impacted the manner in which patients interpreted their later experiences within the healthcare system. The second thematic category included components of stigma, and this category had 6 themes. Number 1, discrimination. Participants identified various acts of discrimination, which included acts of othering, which creates feelings of us versus them. Number 2, stereotypes. Participants discussed stereotypes regarding who contracts HIV, particularly the modes of transmission. There's also stereotypes regarding the behaviors and identity of individuals living with HIV. Number 3, prejudice. Participants discussed prejudice in terms of negative and emotionally charged attitudes. Anger and fear were identified as prejudicial, which in turn could lead to negative attitudes. Number 4, the interplay of various components of stigma. Participants addressed the need to stop the interaction between prejudice, discrimination, and stereotyping. 5, institutional factors. Participants spoke to institutional practices such as policies and procedures that promoted discrimination. And finally, number 6, overlapping stigmas. Participants living with HIV spoke about overlapping stigmas such as injection drug use stigma and HIV stigma, or homophobia and HIV stigma. In this slide, I will briefly discuss how STBBI rates are calculated in case you're interested in knowing. And then I will move on to discuss the different STBBI rates from a Canadian and an Alberta perspective. So rates are calculated per 100,000 people or 100,000 population. The calculation would be the number of cases divided by the population times by 100,000. So for example, in 2016, there were 3,359 cases of chlamydia amongst Alberta teens aged 15 to 19. There were 242,463 teens living in Alberta at the time. And therefore, to do the STBBI rate, you would go 3,359 divided by 242,463, which equals 0.0136 times 100,000. And therefore, the chlamydia rate for Alberta teens aged 15 to 19 in 2016 was 1,385.36 per 100,000 population. This slide provides the chlamydia rate in Canada from 2008 to 2017. That is the most recent data that are available at this time. And there's a comparison between those ages 15 to 19, those aged 20 to 24, and all ages. And again, these rates are per 100,000 population. Chlamydia is the most common reportable STBBI in Canada. You can see from the graph that youth aged 20 to 24 and teens aged 15 to 19 have higher chlamydia rates than the general population. In Canada, the chlamydia rate for teens, and that's represented by the green line, ages 15 to 19 decreased from 1,145.9 per 100,000 population in 2011 to 1,092.1 in 2014. The rate then increased to 1,209.0 per 100,000 population in 2017. Whereas the chlamydia rate for youth ages 20 to 24, represented by the purple line, has pretty much been on an upward trajectory over the past decade, increasing from 1,345.7 in 2008 to 1,870.5 in 2017. Finally, the chlamydia rate for people of all ages, so the blue line, has been increasing over the past decade. It was 248.8 in 2008, increasing to 345.7 in 2017. It contains the Alberta-based data. In 2018, the chlamydia rate for Alberta teens aged 15 to 19 was 1,478.5 per 100,000 population. The chlamydia rate has been increasing amongst Alberta teens since 2014. The chlamydia rate for youth aged 20 to 24 has been on an upward trajectory over the past decade, as you can see from the top line. The rate was 2,055.3 in 2018. And the chlamydia rate for people of all ages was 403.6 in 2018 compared to 348.9 in 2010. So once again, for this Alberta data, these are the most up-to-date data that are reported through the Government of Alberta or the Interactive Health Data application. And later in this presentation, I'm actually going to show you where to find that information for yourself. For those of you that live in Alberta, you'll probably find this slide interesting, and I apologize for those of you that don't live in Alberta. But on this slide, I've broken down the chlamydia rate by Alberta zone. If we look at Alberta's 5 zones, the chlamydia rate tends to more or less increase as we move up north. And it's important to ask the question why, although it's difficult to answer that question, or we can make some assumptions as to why the rates increase as we move up in Alberta, or as we move north. Okay, so moving on to gonorrhea in Canada. From 2014 to 2017, the gonorrhea rate among Canadian teens increased from 102.8 to 150.5 per 100,000 people. From 2010 to 2017, the gonorrhea rate increased from 141.4 to 272 amongst Canadian youth aged 20 to 24. And finally, from 2009 to 2017, the gonorrhea rate increased amongst all Canadians from 33.2 to 79.5. So you can see that there's an upward trajectory in each of those three lines representing the different age groups. And you can see, especially in terms of the youth aged 20 to 24, there's been significant increases. Moving on to the gonorrhea rates in Alberta. Something I should have mentioned in the previous slide was, although there's been a lot of talk and concern about gonorrhea rates, you'll notice that the rate is far lower than that of the chlamydia rate. But the concern is just how much it's gone up. And you can see from this slide that there's a sharp increase in rate when it comes to comparing the year 2014 to that of 2018 data. So from 2014 to 2018, the gonorrhea rate amongst Alberta teens increased from 113.9 to 207.7 per 100,000 population. Going back a little further in time for youth aged 20 to 24, from 2010 to 2017, the gonorrhea rate increased from 123.8 to 393.7. And then again, looking from 2010 to 2017, the gonorrhea rate increased amongst all Albertans from 31.1 to 116.3 per 100,000 population. Once again, here's a slide of the 5 different Alberta zones for gonorrhea. And once again, more or less, you can see that the gonorrhea rate increases as we move up in zone. So the lowest rate is in the south zone at 55.5 for all age groups, whereas the highest rate is actually in the Edmonton zone, not the north zone, but the Edmonton zone has a rate of 164.5 per 100,000 population. This slide addresses syphilis in Canada, once again breaking down the age groups. Overall, syphilis has been on an upward trajectory for all ages over the past decade in Canada. Here are the infectious syphilis rates in Alberta. Infectious syphilis is less common among Albertans compared to chlamydia and gonorrhea. The infectious syphilis rate in teens increased from 1.22 in 2014 to 50.1 in 2018, and that is truly staggering. For youth ages 20 to 24, the rate dramatically increased from 8.0 in 2013 to 86.8 in 2018. The infectious syphilis rate increased in all ages from 3.22 in 2013 to 35.7 in 2018. Once again, this slide provides a breakdown of the infectious syphilis rate according to the 5 zones within Alberta. The south zone had a infectious syphilis rate of 10.1 per 100,000 population, and that is for all ages. Calgary zone 12.5, the central zone 18.5, the Edmonton zone 70.0. So what a huge difference between the other zones and the Edmonton zone. And finally, the north zone 43.5. And this slide addresses the Canadian rates for HIV, hepatitis B, and hepatitis C. The hepatitis C rate, which is represented by the red line, have been stable over the past 7 years. The rate was 31.7 in 2017, so that's for all of Canada. Whereas the rate for hepatitis B has declined since 2013, and hepatitis B is represented by the black line. The rate in 2017 was 13.4 per 100,000 population. And finally, the HIV rate, which is represented by the gray line, has remained stable over the past decade. And you can see that since 2009, from 2009 to 2017, it's fluctuated, between 5.8 and 6.5. So again, not much of a difference over that time frame. So if you're a bit of a statistics or number nerd like myself, and you're wanting to know where this data comes from, there are various databases that contain the data. You just actually need to know how to work with the databases, and you need to know where to find them. So I retrieved all the Canadian data from the Notifiable Diseases online website, and I've provided a website address for you if you're interested. So you would then click on the notifiable disease charts where I have the black arrow pointed to. Once you've clicked on the notifiable disease charts, as per the previous slide, it will take you to this page. And here you can click on the type of chart you want, and there's some different options. Now, this is where I end my discussion of how to find the data. You'll just have to fool around with the different types of notifiable diseases or charts in terms of the Canadian data. If you're wanting to find some specific information and you're having trouble, I would encourage you to send me an email, and I can help you find the information, and then go from there. In terms of the Alberta data, I retrieve all of the STBBI data that I need from the Interactive Health Data application administered by the Government of Alberta, and I've provided the link for you. And once you enter the website, then you need to click on the go to the IHDA data area. Once you click on the IDHA site, it will take you to a page that looks something like this. And then you need to click on infectious disease. You'll then be taken to a page where you're asked to pick a data set from the infectious disease. And I would recommend that you choose STI age-specific incidence rate. So once you choose that, you'll be taken to another page, which is the white picture below the orange picture. And that's where you have the opportunity to choose the different type of data or whatever data that you want. So what you can do is you can choose Alberta-based data, South Zone data, Calgary, Central, Edmonton, North Zone data. You can also choose a variety of age groups and for whatever your interest is. And then you can choose the sex. You can choose the year. At this point, the data only go up to 2018. And then you can choose the different types of STBBI. And in this case, what's included is chlamydia, gonorrhea, MPC, NGU, and infectious syphilis. So thanks for listening to this presentation. As always, we ask you to reflect on the material. So what's the most important concept that you learned in this module? So what? So this is important because now what? So what are two things I need to explore further?